Hi, so you've made it to the last module. Thank you for sticking with me through this whole program. So this is going to be how to talk to your healthcare provider about menopause. We're going to talk about some of the top items to bring with you to your visit, the shared decision-making model, things that you can talk about here with us, or if you go to a different clinic. We just want to arm you with everything that you need, how to talk to your healthcare provider. All right, so in order to make the most of your time with your healthcare provider, especially in insurance-based models, just know that it may take more than 1 to 2 visits, especially if you bring it up during an annual exam. That's not going to be the appropriate time. If you go to someone that you pay out of pocket for, oftentimes they're going to give you somewhere around a 60 to 75 minute appointment, and you can get a lot done in that time. But just know in insurance, it may take 2 or 3 visits to kind of get everything. Again, it's really important, you heard me talking about this before, but kind of coming up with what your top 3 symptoms are. You may have multiple symptoms, especially perimenopause, but what are your top 3 that are the most significant in impacting your quality of life? Also, how long have you experienced them, and what are some of the things that you have tried that have worked or have not worked? What have you found benefit in, and what's just not working? And again, really kind of rate this down. Is it mild, moderate, or severe, and what it's doing with your quality of life? You've heard me talk a lot about this shared decision-making model. It involves a person and the healthcare professional working together to really reach a joint decision about care. It involves really looking at the treatments based both on evidence and on the person's individual preferences, beliefs, and values. It means making sure that you as a patient feel seen and heard, and that you understand the benefits, the risks, and the consequences of different options through a discussion and shared decision making. This joint process really gives you back empowerment. When women are given choices, they make really good decisions, and so every woman deserves this discussion, but it also empowers you to take these decisions about your care and do what's right for you at the right time. So barriers to some of this shared decision making is it's time consuming. There could be some confirmation bias of your healthcare provider. Healthcare providers, as we've talked about, don't maybe feel comfortable talking about this with their patients, or they're maybe not as familiar. And then the litigious environment of the medical community, and that there's so many different things that are being said around the safety of hormones. So some people don't want to have this discussion. So again, arm yourself with finding somebody that will talk to you about all these specific things. In terms of informed consent, that is a fundamental legal and ethical principle. Every patient has the right to be involved in their decisions, to choose what is best for you based on the evidence and the discussions that you've had with your provider. Most decisions rely on you to have verbal consent, and it's not reasonable to share every possible risk of harm, but hopefully doing a series like this is going to arm you with what you need to understand the side effects, the benefits, the risks, and it really should be tailored specifically to you. That's why there's no good algorithm to help with menopause hormone therapy, because it's different from everybody. I think it's also really important that you know your guidelines. You go in there armed with everything that you need. The things that are pointed out in the North American Menopause Society, now called the Menopause Society, but the NAMS position statement from 2022, these are what the key points summarized. And you're going to have this also in this course in your downloadables. So highlight, pick out what's important, but the benefits of hormone therapy outweigh the risk for most symptomatic people that are younger than 60. The risk stratification should be done by age and by time since menopause. So when you went into actually no more periods. Transdermal routes may be safer options for patients, but we no longer go lowest dose, shortest duration. But transdermal, you need to know, does decrease your risk of venous thromboembolism and stroke. Low-dose vaginal estrogen therapy for the genitourinary syndrome of menopause is safe, effective. It's even safe and effective for breast cancer survivors, and there's no systemic absorption with it. Breast cancer does not increase with short-term use of estrogen and progesterone therapy, but actually may decrease with estrogen alone. So again, a very nuanced discussion. It doesn't mean a hard no anymore, but again, it's a shared discussion. For women with GSM and vaginal estrogen, You can use systemic therapy at the same time. So again, something to talk about. And hormone therapy does not routinely need to be discontinued anymore when you hit that 60 to 65 years of age. So hopefully those are the big things that you heard as we kind of go through this. Also, in terms of this position statement, the contraindications are not going to apply to transdermal estrogen because, again, it's not systemic. But the absolute contraindications for using menopause hormone therapy in a systemic form, and they're in these guidelines, which you'll have access to, are going to be unexplained vaginal bleeding, liver disease, prior estrogen-sensitive cancers, coronary artery disease, strokes, venous thromboembolism, or a personal history of an inherited risk factor that's there. So again, really important to know that and have this discussion with your healthcare provider, because there could be non-hormonal options that are available and there could be other hormonal options. But again, it involves discussing what your risk factors are and where that falls. Also, the global consensus statement on testosterone is really, really important. We know that there is no testosterone that is FDA approved for females, but we have a consensus statement that was put out by the Menopause Society and the International Society for the Study of Women's Sexual Health. It's for libido for the postmenopausal woman. We often will use it off-label, perimenopausally, premenopausally, but know that, and you're also going to have that guideline in your arsenal at the end of the course. So what do you do if you have a healthcare provider that won't listen? I think it's really important that you've done this course. You want to spend some time preparing your questions and have your medical history. You need to get vulnerable, but you need to be careful with that vulnerability. If you still have a healthcare provider that may not listen to you, I suggest going to the Menopause Society website or the International Society for the Study of Women's Sexual Health and find a provider that may be able to work with you. You're also free to reach out to us, your clinicians, that can help you navigate this. Talk to your friends that are going through this transition and see if they have a provider that may work for you. Make sure you ask specific questions, and if you're not comfortable speaking up for yourself, maybe taking someone with you, a loved one, a partner, or something that can help you as well. You definitely need to be a little bit relentless in this. So if they aren't addressing your questions, repeat them or rephrase them. You can say things such as, I don't think we're seeing eye to eye. What does this look like? Or I'm worried about this condition. I need to understand it more. Or I understand you have patients to see, but I'm not comfortable with where I'm at. Can we schedule another appointment? Make sure that you give them feedback. And if you're not making any progress in 2 or 3 visits, it's probably time to start looking for another place to go. Speak up for yourself, empower yourself, feel comfortable saying that it is okay if you have found a provider that may not be able to work with you. And then hopefully we can find a place where we can get you the care that you need and that you deserve. So how do you locate a menopause literate clinician? Again, going to the Menopause Society, the International Society for the Study of Women's Sexual Health, the Academy for Innovative and Preventative Medicine, A4M. There's also a lot of digital health companies, Evernow, Millie, Alloy, Geneve, and My Menopause RX. I have lots of listings in there. The Balance app that is from Dr. Louise Newsom, she puts out a wonderful app and it's free. So you can always go over to there and get information there. She puts out a lot of good information in there as well. All right, well, I cannot thank you enough for being here with us. I wish you all the best in your menopause journey. And thank you for sticking through us through this course. And I hope that you're armed with information so that you can navigate this change and this transition with your healthcare provider. See you soon.